Hello everyone, my name is Dr. Daniel McMahon. I am a family medicine doctor over here at Northside Primary Care Associates over in Holly Springs. And I am here today to speak with you about questions that I would like to hear when my patients come in to see me, things that I would like to be asked, and go over those type of questions and answers.
To start off with, what are preventative care services?
Preventative care services are a huge part of what I do, and all primary care and family medicine doctors, that's maybe the most important thing that we do. It focuses on preventative health, and there are many tests that we can use when it comes to these type of services that help us keep a person healthy in the long term, catch things before they start really going wrong. That's maybe the main purpose of the whole thing too. So when people come in asking what type of preventative services are right for me, there's usually a good long list that we can go down and find which ones are necessary, which ones maybe aren't. Such things include breast cancer screening, colon cancer screening. These are all important things, and they need to be stayed on top of. So as I said before, we don't run into things down the road that if we caught them earlier could have been completely avoided in the first place.
What should I work on before my next appointment?
All right, great, and that's a fantastic question, because we all have things that we can definitely do to improve our health in between doctor's appointments. There's the usual stuff, of course, where eat healthy, plenty of sleep, plenty of exercise. That's stuff that we all certainly need to do. But then there's definitely other more specific examples of things that require maybe a little more aggressiveness in between visits. And diabetes is an example that comes to my mind. It's incredibly important to eat a low sugar diet, low carb diet, get plenty of exercise, which is a key, obviously, with diabetes, but then also being very strict and staying on top of your medications, being consistent with them. Blood pressure is another good example of things that can be done in between the visits. Obviously, there's the medications we use to help with blood pressure, but healthy diet, exercise, low salt diet. These are all things that can help improve a person's blood pressure in between doctor's visits that, again, aren't medication based. These are lifestyle things that can improve the overall health of somebody as well as certain conditions. But overall, you're just working on your overall health, and you're going to come in better than you left if you do those things.
When is the best time to see a doctor?
The best time to come in to see a family medicine doctor or primary care doctor is an unusual answer, but it's actually when you're the healthiest, when you are feeling good, because that's the way we want to keep you. We want to keep people at their best, and that's where a lot of our preventative services come in. We have someone come in, many times it's just once a year for a yearly physical, but that once a year physical can turn up potential problems that somebody maybe never would have known about had they not come in the first place to get this stuff checked out. Because a lot of times you feel great, and that is great, but we want to make sure that, again, there's nothing that could be lying under the surface that would require our attention and some kind of early intervention.
Which internet resources can I trust to get medical information?
So that's a very good question, and that's a very common question I get too. There are so many of those websites out there that many of them have great information, many of them have bad information or non-accurate information. So it's really important to distinguish which is which. There are a few that I recommend or will use occasionally myself. One of them is very popular, WebMD, which most of us know about. It's a good website. It gives good information. It's factual. I usually will tell my patients, don't dive too deep into it until you've spoken with us and actually know what kind of condition we're actually going to be treating. But it's a good source, and it can provide some good information. Mayo Clinic is also a very good website too. It's got a lot of good factual information. It is broken down too into symptoms, treatments, testing protocols. So it has a lot of valuable information as well. The one that I prefer and the one that I use most often is a website called Up to Date. It has maybe the most extensive information, database of information on multiple or medical conditions, anything you could possibly think of. But all the information there is peer-reviewed by other doctors. It is good, factual stuff that you can trust. And it is available to the general public. You don't have to be a doctor to be able to get on that website. And it can give you just a good overview of what's going on, but don't go onto these websites trying to diagnose yourself, because you'll diagnose yourself with something crazy that's definitely not happening. So it's best to come to us over here at Northside Primary Care, and we can help you get that diagnosis, and then that's maybe the best time afterwards to go look at some of these sources.
What changes do I need to make to my medications?
Medication questions are maybe the most important thing. Everybody these days is on something, it seems like. So we like to make sure that a person's medicine list is up to date, and I always really want my patients to know when I have them on a medicine, I want them to know why they're taking it, be able to tell me, I want them to be able to tell me why they're taking it, how much they're taking, if they're having any side effects, any problems with it. So, you know, for the doctor-patient relationship, being on the same page in terms of, you know, what a person is on and what medications they're taking, that just makes, I think, everybody's life much easier, because we can decide, hey, is there something that's not working? Do we need to go another way? Or do we need to increase a dose? Do we need to lower a dose? Medications are definitely the main thing that we do when it comes to treatment for most things, but we can absolutely work as a team to kind of find that best match.
How does my family history affect my health?
So when it comes to family history and genetic risk, things like that, whenever people come in and they have to fill out the pile and the giant stack of papers that we make everybody fill out every time they come into a doctor's office, one of the biggest sections in that pile of paper is the family history. And the reason we make people do all that is because certain conditions carry a heavier genetic risk. And if they run in the family, these are things that we want to know about, because it can change our approach and our level of aggressiveness in how we're screening for somebody. And a good example of that is something like a colon cancer or a breast cancer. Colon cancer is an example I like to use, because if we have someone, first-degree relative, for example, who has been diagnosed with colon cancer, the other members of the family would need an earlier screening compared to your average timeline, which usually would be in between 45 and 50 is when we usually recommend colon cancer screening. But for someone who has a family history of it, we start that a little earlier. We start that screening process earlier as an extra precaution because of that increased inherited or genetic risk.
Are my supplements worth taking?
I love it when people come in and ask me about supplements, because it is a never-ending box of tricks when it comes with that. There are so many out there. It is absolutely understandable for people to have questions about that, because you don't know which ones are good for you, which ones are bad for you, or is this helping me, hurting me, is it doing anything at all? So it's definitely an understandable question. When it comes to supplements specifically, most are fine, most are safe for you, but there are definitely ones out there that have the possibility of interacting with maybe some of the prescription medications that you're on. So before any kind of new supplement is started, we always want you to come in and speak with us so we can give you a little more straightforward information to say, hey, not a good idea, or yeah, that's no problem. That won't cause any issues for you with your current medications. But that's always the big concern, is do we have to, you know, worry about a supplement making a medication that you're currently on, a prescription medication, ineffective or too effective, or essentially just causing some kind of adverse effect. And coming in and speaking with us is usually the best way to figure that out.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.